Hello Gemma, how are you? It's Martin, come on in.
And we're going to draw a little grid on the back. And when we draw our grid on the back, we're going to add a little allergen to each one. A little bit tickly, Gemma. And each square is going to represent a different allergen. And these are little allergens that are diluted. And as they are diluted, they will start to react with the skin. And each allergen is going to be scraped into the skin. As it is scraped in, it starts to produce antibodies with the skin. And as it produces antibodies with the skin, a number of chemicals are released from the cell, the main one being leukotriene and histamine. And it is histamine that we are going to be concerned about. Now we are doing the dust mite, grass pollen, tree pollen, various different moulds, cat and dog. And we note that Gemma has a cat, so we'll put a little X beside that. We're then going to do some of the foods. The reason why is that especially small children tend to have food allergies that induce wheezing. So that would be the reason why we would do that. Now we have almost all these placed on her back, and we are now going to scrape them very gently into the system. We will wait 10 minutes and we'll see what happens. What we're looking for is a tiny little wheel. And we use positive and negative. Always for testing you would use a control. The control in this case is going to be a positive and negative histamine. And we will measure against a control, a known control. So a little tiny scrape, and then we're going to dry it, and we're going to wait 15 minutes. How you doing? You all right? Good girl, well done. On looking at Gemma's results here, we can see very clearly that she is positive to dust mite, cat and grass pollen. What we need to do is to speak to Mom about reducing the aeroallergens and talk about the possible removal of the cat outside rather than inside.
I'm Dr. Ryan Kaufman from Northwest ENT, and I'm going to be allergy tested by our allergy department and allergy nurse Vanessa.
My name is Vanessa, and this morning we're testing Dr. Kaufman. The first step to allergy testing is going to be to prep Dr. Kaufman's arms, and here I am with a whole wipe, just wiping the arms. We are going to be testing this morning for 40 different types of allergens, and that would include trees, grasses, dust mites, cats, dogs, molds. And the type of reaction we're looking for this morning is going to be a mosquito bite reaction. That's an indication that this test is going to be positive. If we don't get any type of raised skin, the test will be negative. I'm going to label every single panel. We have a combination of, well, actually altogether 5 panels. And labeling panel A, starting with 1 through 8, panel C, and I will continue to panel D and E. Alright, the skin test here is what the actual device looks like. It is conformed of 8 different small pricks. It's called a multi-test device. The way we're going to test Dr. Kaufman is by just applying pressure. And here we go. And we're going to rock it north to south, east to west. We are not breaking the skin. We're not rupturing the skin. We're applying light pressure. Again, north to south, east to west. And that is the final product. Panel number 2, or B, same procedure, north, south, east, and west. And again, just applying pressure.
And again, this is not a painful procedure. I do feel her applying the pressure, but you don't even see me flinch because it's not painful. You do feel small portions of the sharper ends of the probes, but nothing painful.
we're continuing with panel D, north, south, east, and west. We're just rocking the probe for the device. And final step, panel 5. We're going to time all of these allergens for about 20 minutes. And at the end of the 20-minute mark, we'll get to read every single allergen on the skin. And there we go. Alright, at this moment we're doing intradermal testing, and this part of the test would allow us to find out the severity of Dr. Kaufman's allergies. The first part of the test was a skin test that told us what Dr. Kaufman was positive and negative to. This part will tell us the severity, whether it's mild, moderate, or high, and is a small prick, more like a TB injection.
It's a very tiny, almost imperceptible prick, but you can feel it. It's not terribly bothersome.
The doctor has sent you back today for some allergy testing. Well, we're going to go ahead and get started if you want to.
Okay.
The first thing I'm going to do is just place some allergens here on your arm. These are going to sit for 20 minutes after I place them.
Okay.
And after 20 minutes, we'll measure those. I'm just going to hold your seat on top. Take a deep breath for me. Just rocks a little bit. Alrighty. Now these may leak just a little. So we'll just blot them. There we go. Now those are going to sit for 20 minutes. We'll measure those. That's going to let me know if I need to do some skin tests right after, okay? So we're ready to read your skin test and see what we can find here. We've done 2 controls. One is to make sure that you're not allergic to the antigens, what the antigens are mixed with, and the other one is to make sure you have not had an antihistamine. Not that we didn't doubt your word. Okay, Luke, I found you sensitive to 2 antigens, Timothy grass and ragweed. That's these 2 right here. So for those that did not react, we're going to put a skin test on the upper part of your arm with a different dilution. So before we call something negative, we test it again to make sure. I'm going to turn you this way, and I'm going to use the upper part. And there you go. And these go on with a little needle, but I promise they're just under the skin, okay? Alrighty, sir. We'll do these right here. I think we can get them on your arm. Okay. Just make sure that latch on. And what I'm doing is just putting a little drop of the antigen under the skin, and these will measure after 10 minutes. Right, Luke, let's measure these and see what we've got here. We just want to... Well, I didn't find any other reactions. These would have had to show 7 millimeters or greater. I didn't show any other reactions today, so we'll go back and see the doctor and he'll talk to you about your allergies to grass and ragweed.
If your doctor suspects that you have allergies, your doctor may recommend an allergy test. It is the same test for children and adults, and it is usually carried out in your allergist's office. Most people say the test feels like a little prick or sting, but it's not painful.
Good morning. You ready for your skin test?
I am.
Good. Come along with me.
An allergy test may be performed on your back or forearm. This video shows the latter. The nurse will prepare the test area by wiping it clean with alcohol. Next, the nurse will make a series of small marks on your arm with a pen to indicate where the test will be applied. The nurse will place a tiny drop of allergen by each mark. In this example, the test includes grasses, molds, and fungus found in the environment. Also included are common trees such as elm, maple, walnut, and oak, plus cat, dust, and other common things that people encounter. Once all the drops are in place, the nurse takes a tiny pointed plastic instrument called a lancet and scratches the skin through each droplet of extract. A new lancet is used for each scratch. It takes about 15 minutes for the reactions to develop fully. At that time, the nurse will return to measure the reaction, which appears as small circles of inflammation called wheals. The wheals can itch and they look like mosquito bites. The severity of allergy is measured by the size of the wheal with a millimeter ruler. After the test, the nurse may give you some cream to rub on the test area in order to relieve the itching and discomfort from the skin test. The redness, bumps, and symptoms usually subside within a day. It is unlikely you will need another allergy test if the treatment program brings your allergies under control. Once the test results are calculated, your doctor will talk with you about the results and possible treatment. Depending on the severity of the reaction, your doctor may recommend one or a combination of therapies, including immunotherapy or daily medication, and how to avoid the allergen.
I tend to get a lot of itching and irritation beneath my bra strap at the back where the hook is. If I wear costume jewellery, my ears will blister and really swell up and be very, very itchy. I can only tend to stick to sort of gold and silver, but even sometimes silver jewellery will bring me up in a rash. But it always tends to be underneath earrings, underneath jewellery, as I say, on my bra strap as well.
So how long does the rash tend to last when you get it?
Depending how quickly I realise the irritation is there, if I take the jewellery off very quickly, it'll probably go down after a day or two. If it's quite severe, it can take a sort of week or two to actually completely die down if it comes up, as I say, severely. But sometimes I also react to things like perfumes. I never ever wear perfume around my neck because it will bring me up in an irritation. Some body lotions, I have to stick to sort of fragrance free. So it may be something like that as well.
So what we're going to do is a patch test then, if that's okay. We're going to use one of these commercial panels, which has got, well in fact two of these commercial panels, which have got a range of chemicals on, including nickel, but also chemicals found in perfumes and fragrances and cosmetics, and other chemicals as well that are found in medications and things. And hopefully this will tell us what it is that you're allergic to. So what we're going to do is stick these on your back, one on each shoulder blade roughly, and then leave them there for 2 days, 48 hours. And then we need you to come back so that we can take the patch off and have a look and see if there's any irritation underneath. Now, if you feel a bit of irritation under the panel, that shows the test's working, so that's to be expected. But if it's really bad, if it's driving you mad, there's lots of itching and so on, then you can take the test off early if necessary. but then we need someone to mark where the panel's been on your back so that we can still read the result when you come back again. So is there someone at home who'll be able to do that?
Yeah, yes, no problem.
So I'll just show you the tests, because we're going to stick them on your back and then you won't be able to see what they're like. So it's always good to know what we're doing. So this is the panel. It's just sticky paper, hypoallergenic sticky paper, with all the different chemicals that we're going to test in squares on the paper. So we'll just peel the backing off, stick this onto your back, and you'll notice there's a little cutout there. What we're going to do is mark that with an ink blob on your back, and there's another one at the bottom there. And that shows where the patch test has been. So if you do have to take it off because it's really driving you mad, then we'll know from the ink blobs where the test was, and that means we can check the results when you come back to see us. So there'll be 2 of these, one on each side of your back. Is that okay?
Yeah, it's fine.
Fine. Okay, so if you can just, that's it, that's fine.
Okay.
We just need your hair out of the way as well, if you can manage that. Great, okay. So I'm going to stick 2 panels on. One on each side of your back. Just need to smooth them down. Okay, so that's one. And that's the second one.
Okay.
Now I just need to mark the cutouts with a pen so that we know where these are if we do need to take them off. And the same the other side. Okay, and if you should feel that these are starting to peel off, it's okay just to stick down the edges with a bit of tape.
Okay.
And as I say, if they do become really irritated, then get someone to take them off.
Okay, fine. Thank you.
Now obviously you need to keep those patches dry, so you're going to have to avoid showering for the next couple of days.
Okay.
And I'll give you this leaflet which explains all about the tests, what's in them, what to do if there's any adverse reactions to them and so on. And we need to see you again in 2 days' time so that we can take the tests off and have a look and see what the results are.
Brilliant, thank you very much.
Okay. We use patch testing to identify the allergen triggers in contact allergic dermatitis. In this sort of allergy, the immune system hasn't made antibodies to fight off an allergen, so blood tests looking for antibodies are not appropriate. Instead, certain immune system cells, called T cells, have themselves become sensitive to a particular substance, and when that substance is applied on the skin, it produces a local reaction, usually in the form of a weeping, itchy, red rash. This reaction arises quite slowly after the offending substance has been applied on the skin. It doesn't usually produce an immediate allergic reaction like an antibody reaction can do, and this can make identifying triggers in contact allergy quite difficult. Some sorts of allergens, like makeups, can be tested by an informal patch test, either an open patch test where you just apply the same makeup to the same area of skin a few days in a row and see if that produces a rash, or a closed patch test where you place some of the test substance on, for example, a sticking plaster, apply it to the forearm and see if it produces a reaction over a few days. But this sort of informal test is only appropriate for things like cosmetics and soap powders that you're using at home if your symptoms are fairly mild. In more severe allergic contact dermatitis, or where we're not sure what the triggers are, then we use commercially prepared patch test kits. These contain a range of substances which are known to be common causes of allergic contact dermatitis. Things like nickel, cobalt, a range of fragrances, chemicals used in the manufacture of rubber and in print, and chemicals used in medicines, as well as some chemicals that people might be exposed to at work. Patch tests are applied usually to the patient's back on a clear area of skin and left in place for between 2 to 3 days. They're then removed and the skin is examined to see if any areas of inflammation have occurred where the skin's been in contact with a particular chemical. Sometimes the reaction can come up after the patch test has been removed, so normally the skin's examined again a further 24 hours later to see if a late reaction has developed. This means that the patient will need to attend a clinic at least twice and maybe 3 times, once to have the test applied, 2 to 3 days later to have the test removed, and then possibly again a day later to have the test site looked at again. Interpreting the tests can be quite difficult. Some chemicals cause reactions just by irritating the skin rather than by allergy, and there are different grades of reactions. So patch tests need to be applied and removed by someone experienced in their use and who can interpret the results correctly.
2 days later, Lindsay sees our primary care allergist to get the results of her patch test.
So how have things been then?
It's been quite itchy. Shortly after you put the pads on, about 20 minutes, half an hour, I itched everywhere. So my arms and legs just went mad for about an hour or two. That settled down, but now it is quite itchy under the pads.
Okay, so let's have a look and see what results we've got. I'll just peel these off. And the other side. Okay, so on the first test we just have nickel as shown as a positive. And on the second panel there aren't really any positives there at the moment. So nothing there at the moment, but what we need to do is look and see if anything comes up over the next 24 hours.
Okay.
So Lindsay, the result confirms that you do have a contact allergy to nickel, which I think confirms what you suspected anyway. So that means that you need to avoid wearing jewellery that has nickel in, so pure gold for example would be okay, whereas cheaper jewellery which has got nickel included in it is likely to bring up the rash. And you'll also find that that's the reason for the rash on your back from the bra clip, which probably has nickel in it as well. The perfume didn't show a positive, so I know you said you get a rash sometimes when you spray perfume around your neck, but I suspect that's probably an irritant reaction rather than a true allergic reaction. At least that's what this test suggests. So I've got a fact sheet here with information about nickel allergy, which I can give to you, which will explain the sort of places where you find nickel and the things you can do to try and avoid it.
Okay, lovely, thank
And
you very much.
let's see how that goes.
Okay, brilliant, thank you.
Shut the door for your privacy. My name's Heather. I'm going to do your testing. How are you?
I'm doing well. How about you?
Good, thank you. So today we're going to test you for the things that you were negative for from your previous test. It's going to go on in 2 rounds. Each you're going to sit on for a total of 10 minutes. I'll apply the first round, make a little bubble right underneath your skin, and then that'll sit on for 10 minutes. I'll come back and measure those. Anything that you're negative to, I'll reapply a stronger version of the same thing. Anything you're positive to, we'll stop right there. Okay. Do you have any questions?
Is it going to hurt?
No, most people tell me it hurts less than the last test you had, the prick test.
Okay.
Okay. Start by labeling your arm. Ready?
Ready.
Okay, that's gonna sit on for, like I said, a total of 10 minutes. I'll come back, I'll measure those, and then we'll see what we have for the next round.
Okay.
All right. I'll be back in 10. Thank you.
And then, once that dries a sec, I've got to mark which test is which on your back here with my little purple marker here. So you're going to have some purple polka dots on your back. Alright. Alright. So here we go. Are you ready?
Yep.
Alright. Okay, these are the controls here. And then we'll start all the rest of them. All done. Now we just got to set the timer for 15 minutes and we'll see what we get. Okay, Kate, well it's been about 8 minutes, so I'm going to wipe off the two controls and then I'm going to measure how much redness and welting there is at that positive one. Okay. Just got a ruler here so that's not going to scratch you or anything. Okay, and I can wash that off in just a minute. And at least that one won't quit itching you quite so much. Feel good to scratch that one? Yeah. Yeah. Okay, so we just got about 7 more minutes left for the rest of them, and then we'll measure those and then you'll be done.
Okay.
All right, girl, we're at about 15 minutes. I'm going to get a tissue and wipe this off, and we're going to measure what's positive there. All right. Okay. Right, I think the rest of them look pretty negative. They all look like the saltwater ones, so we can just scrub them off now. We just got to take that alcohol again and, whoops, wash the back off a little bit. I bet that dust mite one is pretty itchy, huh?
Yeah.
Yeah. It'll feel better. And the itching from that, now that I've scrubbed the histamine off, the itching should be better in about a half an hour. But if it's really bugging you, we can probably get Dr. Taylor to order a little bit of Zyrtec or Claritin or Allegra or something for you. Okay, there we go. So let me tie this for you and you can sit on up. And we'll give Dr. Taylor the results and she'll go over that with you.
First, we cleanse the test site with alcohol. Then we wipe away any excess liquid with gauze. Then we label for the testing that we're going to do. In this case, we'll test for grass, cat, sagebrush. We also do a positive and a negative control for comparison. As you can see here, the 2O tips are submerged into extract containing the individual allergens. The tip is designed so that it holds onto a drop of the extract when we remove it from the testing wells. Then we use that tip to lightly scratch the skin cells, roughing up the top layer of cells and depositing a drop of extract at the test site. This allows the skin cells to interact with the individual allergens, and if there is a sensitivity, it will initiate an immune response. The test stays on for 15 to 20 minutes, and at the end of that time, we read the results. What we're looking for in an immune response is a raised hiver wheel in the center. It resembles a mosquito bite, and it will be surrounded by an area of redness or erythema. The size of the wheel and the size of the surrounding area of redness is directly related to the degree of sensitivity to that particular allergen. Once all your test results are read and recorded, we cleanse the site with alcohol, and then we apply an anti-itch gel. At this point, the doctor will come back into your room, discuss your test results, and a treatment plan for your care.
I'm going to start with the first skin test. So I have done 8 of these. My staff and I always mark the skin just to make sure we know where the skin tests have been placed. Each of these are a group of allergens. There is a pediatric kit and there is an adult kit. What you're seeing is a very limited amount of allergens that we do in children. So the first set is dust mites, cat and dog. The second set on this panel is grasses and ragweed. The third set is tree pollens and the last set is mold. You let the skin test stay on your skin for 15 minutes. If you're allergic, it itches, it does not hurt. And what you see is a little red mark like a mosquito bite. So we're going to wait for 15 minutes and we'll come back and show you positives and negatives. So in 15 minutes, the skin test is ready to read. And I want you to appreciate this entire panel. That's the tree pollen, which is negative on the patient's back. But we have snuck in some controls. This is histamine, another histamine, and another histamine. Histamines are controls placed to make sure that the patient has not taken an antihistamine. And when it's positive, it means this is a very good test. On this patient's back, we have dust mites, which are positive. And I want you to appreciate that it's red when compared to a negative test. So this patient is not allergic to dog and cat dander, not allergic to grass ragweed, not allergic to any tree pollens or mold. This patient is allergic to dust mites. Either we call this a positive or a negative reaction, or we measure it. When you measure it, it helps me decide in 2 or 3 years if you have outgrown allergies. For example, the patient's dust mite today measures approximately 5 millimeters. And if I treat this patient 2 years from now, if it becomes 2 millimeters, I know that this patient has been treated. So I want you to appreciate a negative skin test as opposed to a positive skin test, which looks literally like a mosquito bite. At this point, the patient's back is wiped off. The entire process took us 15 minutes. And to make the patient comfortable, cortisone cream is placed. The patient can go back to their daily routine. If this patient does not scratch her back, the itching will go away in about 30 minutes.
So I'm going to start by washing your arm. That's not because I think you're dirty, but these days most shower gels and soaps contain a little bit of moisturizer, and that will make my allergen drops roll straight off your arm. Okay? Now I'm going to put numbers on you, which saves writing on your skin. And these numbers relate to the allergens that I'm going to put on you. There we go. Right, I'll tell you what I'm doing as I go along. This is the only one I want to see you react to, all right? That's because it's histamine, and everybody should be able to react a little bit to that, whether they're allergic to other things or not. That one, number 2, is the solution that everything else is dissolved in. Oddly enough, some people are allergic even to that, and it's just glycerosaline. Okay. This one is aspergillus, which is a sort of fungusy, mouldy thing. Okay. Very similar to the stuff you find in badly kept bathrooms.
I've just redone mine, so hopefully not.
So that should be all right then. This is a yeast, airborne yeast. Again, a lot of people are allergic to that. And then we move into tree pollens and grasses. Now these are a family favourite, dust mites. We've got two kinds. We've got American and we've got British.
Okay.
And you'll be glad to know that the American dust mite is bigger than the British. There just seems a kind of lovely symmetry about that, doesn't there? And then we get feathers and cat. Do you have any pets at all?
I've got two cats.
Do they make you itch or sneeze?
I don't think so.
You'd know if they did.
Yeah. I don't want
Having done all that, I now need to get the allergen under your skin.
Okay.
So these are the little things I was telling you about that make a dent and a little scratch. They're not actually needles, right? So here we go. W-E-A-L. So I'm just going to outline that bit. It's quite good. Sorry, I have made it look a little bit like Mickey Mouse. And then we just lift that print.
The purpose of this test is to decide which allergens to use in allergen-specific immunotherapy, which is one way of trying to control this disease. The first injection is the positive histamine control. This produces a red raised wheal at the injection site. The second injection is the negative control, and this is the saline in which the allergens are suspended in. At the remaining sites, we inject individual allergens such as house dust mites, forage and storage mites, grass, tree and weed pollens, and various moulds. A positive reaction produces an inflammatory wheal similar to that of the positive control. This develops within 15 minutes. It is very important that this test is not performed until all other causes of the animal's itchy skin condition have been eliminated. This is due to the incidence of false positives which can occur occasionally with this test. Diseases such as food allergy, scabies, and flea allergy all have to be ruled out, as do other external parasites and yeast and bacterial infections, as these can all contribute to an itchy skin condition. Here we see the results of the intradermal skin test in this dog. On the left there is the positive histamine control. At the fifth site along is the positive reaction to the house dust mite Dermatophagoides farini. And further along there are positive reactions to 3 different species of forage and storage mites. These mites can be found in house dust and can also be occasionally found in sacks of dried dog food which have been left open for a very long time. Further down there is a positive reaction to Malassezia. This is a yeast that's present in dogs' ears and can also cause problems in dog skin affected with atopic dermatitis. Allergy to this yeast will exacerbate an already quite itchy skin condition.
What are some of the things that you're testing me for? Trees, grasses, weeds, mold, then dust mites, cat and dog hair, feather mixture, cockroach, and then the rest is foods.
Okay.
Mhm.
Okay. What's the deal with the cockroaches?
Basically, it's not the cockroach itself. It's what they leave behind after they're, like, dead. That's what Dr. Pennemas told me.
Interesting. Okay.
Okay.
Ew.
So I'm going to use all your upper back.
Okay.
Okay.
And then you do a little grid.
Yeah, because they have to, because we're doing over 9 applicators, so I need to make sure.
Which one's which? Yeah. Got it. Okay. How accurate are these?
It all depends. Certain things that come out negative here, it doesn't mean that you're not positive.
Okay. Okay. She has administered all of the shots. Well, they're not shots. They are scratches. They felt like shots. And now I wait 20 minutes. But my back certainly is itchy. Wait, what?
Weeds.
Weeds?
Mm-hmm.
Like what kind of weeds?
I'll show you.
Like weed?
No.
Kidding. Like ragweed kind of thing?
Like ragweed, yeah.
Oh, okay. Which ones look bad? Lulu is filming. How does it look? This my back is so itchy. Feels crazy. Lou, scratch me right here. Scratch me right there. No, don't touch me. You're not allowed to touch me.
Just because it might be negative here, but it doesn't mean that you're not positive.
Okay.
Is there any dog?
So if Dr. Salvador recommends the second part,
okay.
If she recommends the second part, we're only gonna test the ones that came out negative here.
Oh, okay.
Okay. Doesn't mean that you're negative on dog, because here it's negative, but once we inject you the concentration of the dog.
So is there any way that you can make a concentration from my dog?
No.
Oh,
not from your dog.
Okay.
No.
Like if I were to bring in, you can't like make a little serum with it or anything?
No.
Okay.
No.
Just wondering. Thought I would ask. Thought it was a good question.
How does it feel, Gordon? You see why Charlie was having issues now, I guess. Poor kid.
First one she took is the lower back.
Yeah, I always start at the top because they go, oh, that's not bad. And then I start until they get to the bottom. They are testing for all of that.
So a whole bunch of different types of trees. Weeds. So do they generally avoid numbing for this? Just because it messed with the test?
No, just because this is usually pretty fast and
not worth it.
Painless. Yeah, just a quick, like you're being scratched real quick and it's done. And then after that, it's just, I guess the problem that will be for him to see will be itching. If he does have anything he's allergic to, it will look like a giant mosquito bite.
Oh, fun.
Really, really itch. So.
Yeah, we did this with our son when he was 5. Not the most pleasant experience for him.
I didn't
right?
Scratch test.
You did it?
Yeah, she didn't. We were really lucky.
Okay, that is it. I will be back in 5 minutes to check on you.
Okay.
No scratching.
Don't scratch, Gordon.
Scratching Gordon.
Some of them are already looking a little bit reddish, but they did just scratch you, so.
My back's itchy normally.
It's true.
It's the worst.
Poor Gordon. I'm sorry.
Okay.
Here on this side of your back, this is 1 through 20. So 1 through 20. So this is all.
Oh, so they're not doing the foods.
No, well no, they're not doing foods. So it looks like they're just doing to here. So. And then this side is 21 through 42. House dust. Let's hope you're not allergic to that, because that means I have to dust the house more. Oh my goodness, Gordon. I love you. I'll scratch your back later, I promise. This side, this whole row here is really red.
Which row? The last one?
21 through 31.
Now I'm going to draw some letters on your arm.
That tickles.
Next, I'm going to pop some little droplets on your arm. They're like little raindrops, so it's really important you keep your arm nice and still so the droplets don't run off your arm.
Is this okay?
That's perfect. Now we pop the bubbles.
Feels a bit like a scratch, but it doesn't hurt.
Now all we have to do is wait for 15 minutes to see if there's anything you're sensitive to. It might come up like a little mosquito bite, but it's really important not to scratch them. Now I'm going to wash it all off. Pop a bit of cream on. And you're all done.
Clean off your back. Have you ever been skin tested before?
Yes, I have.
Okay. You're okay. Okay, so now that I clean off the back with the rubbing alcohol, I'm gonna get it dry with tissue. Then, you know what, guys, I think I forgot a pen. So let me go get a pen really quick.
Do you have any last words?
Yes, but my skirt is uncomfortable. It's all twisted.
Because it's a total of 54. So once I do my map there, I'm gonna start putting the drops, okay? So each drop, it's a different thing. That's mold, grasses, weeds, trees. We have the rabbit dander, dog dander, cat dander. So I just have to put all these drops on the same way I drew on your back, so it can match the tray.
So, have you ever seen somebody react like really, really bad before?
Yes, I always see like some people, like maybe 1 or 2 out of the whole week react really bad. We do like 4 to, it can vary from 4 to maybe from 4 to 8 testings a day.
I'm pretty sure you're about to get one of those bad ones. She hadn't even poked you yet and you already got red spots.
But we do a lot of skin tests during the week. There are some people that are so allergic that they even react to the skin test, but that's like very rare. Like they get like anaphylaxis. That's what I meant by reacting. Oops. The placement takes like around 7 minutes.
There's a lot to place.
And the poking takes like less than a minute.
My least favorite part.
Mm-hmm.
Do you have anybody freak out because of the poking?
Yeah, we do kids too. Like we do the oldest I've done is like maybe 7 months.
Oh my god.
Mm-hmm.
Allergy testing at 7 months? That seems...
Yeah, because if the parent has like a history of food allergies, they want to test them before they start any foods, especially if it's tree nuts.
Oh,
that makes sense.
Mm-hmm. And a lot of kids that have their parents with like tree nut allergy, like the most common is the peanut, they come up positive. So that's when the EpiPen comes into play. avoiding all the nuts. And I think the peanut allergy is the worst food allergy that you can have.
I agree. I love peanuts and peanut butter.
Mm-hmm. And it's everywhere, to be honest.
Yeah. You have to read all the labels, make sure that it wasn't even processed at a plant with peanuts.
Almost done with the drops. But I think the babies are pretty easy to do because they don't even know what's going on. Just toddlers or even like kids that are like maybe between like 8 years old or 12 years old. They're like really hard to do because they're so strong or they move a lot.
Yeah, they're very aware of what's going on.
Like 6-year-olds or 7-year-olds, those are hard too. We had this kid like wipe off his whole test after I was done placing it. It was no fun.
I just, you have to do it all over again.
Mm-hmm. Okay, here comes the pricking, okay? Let me know if you need a break.
Nope, just don't show me the needle.
So once I start pricking, I have to wipe it off with this gauze every time I prick so it doesn't contaminate. It's just a really small lancet. So it's not like I'm injecting you with anything, it's just going under your skin a little bit. Do you have sensitive skin?
A little bit, yeah.
Okay, 6, 5, 4, 3, 2, 1. That's it.
All right.
Okay, so we do a 10-minute timer.
Okay.
I will be back. Don't touch or scratch your back, otherwise it will ruin the test, okay?
Okay.
I will be back, guys.
Thank you so much.
No problem.
You know, through the camera lens, they kind of look like real big stitches. That one seems to be pretty bad. Whatever the top right corner is. Don't touch it. Don't touch it.
I'm not touching it. I'm moving my hair. Oh my god, I want to scratch it so bad. It itches already.
Well, I mean, just look at it this way. You only got 9.5 minutes to go.
Yay.
You having a seizure?
No, it itches so bad.
I don't know how they expect you to last for 10 minutes without itching there.
It's your fucking willpower.
Approximately 120
So we're about.
settlers left England and sailed to
I want to pause that.
off the coast.
No, it's distracting me.
Okay.
Arriving sometime in
So we're about, I don't know, about 3 minutes in.
of the new 1587
That's a lot of red.
settlement was John White,
It's like a lot of red.
an artist. They were a few small attacks from local Native Americans.
Trying to just
So the vast majority of the ones on the right, or your left, towards me, right, are all like fiery red. Well, fiery might be the wrong term, but the middle's pretty bad too. And then only these 5 right here on this side, like here.
Don't touch. You're not supposed to touch.
No, I'm touching on the other side. I'm not touching them.
Don't touch me.
Excuse me.
Don't touch me. I want to scratch it, and you're just teasing me.
To a daughter, and White's
Really?
granddaughter, Virginia, did
Uncle?
the first baby
Yes.
born in North America. To
Trying to distract myself with BuzzFeed Unsolved.
That's cool.
Uh-huh.
Yeah, and she's kind of like, at least the name Dare.
So like if I did something like,
Josh, I swear to God, I will fight you.
Pain in the ass to have to go back to England all the time.
this is actually rather enjoyable for me. We should do this more often.
Now you're supposed to be comforting me.
No, that's what BuzzFeed's for.
Well, looks like I'm back in the boat.
Oh,
Yeah,
scratch it.
Today on Diary of an Allergy Queen, we find Evelyn has a breaking point.
White's timing was poor. England was on the verge of going to war with Spain, which had a particularly strong.
I'm gonna go with minute 8.
He was unable to return to Roanoke for some time. It was not until August of 1590.
Actually, you know what? Because time seems to be moving more slowly. You're probably like halfway there, then. So hang in there. So we're at minute 7-ish, and we got hives forming on a lot of these. Pretty much that entire row, and several in this row.
Really, oh my god, that one, there's only, I mean, it just itches. Like, it doesn't, there's just that one that hurts. There's one that's like right side closer to my spine that is about mid-back, and it hurts. That's the only one that hurts.
Okay, so little poke here, histamine right here. Itchy boo. No scratching though.
Can you see my boobs?
No.
Okay, just checking.
Starting to itch right here.
Yeah. You see me trying to air itch it?
Alright, let's get your autologous going. Can we do left arm? Is that okay?
Yeah. That's where he drew the blood from. Is that okay?
Yeah, that's fine.
Can you?
Tell me your birthday.
June 3rd, 1984.
Well, look at your forearm for me. We'll place it right about there. Alright, try to keep your arm real still.
Did you see that, babe? It was like. Did you see it?
Not really.
Here, look. I'll show you. See it?
Yeah.
Oh, they extended my game ready machine out wait for a month.
Okay.
And I asked them if they had the a smaller boot, and he said he's gonna look and see. And pickles.
I think I got all the days on there. I got 2 hours.
Ready for the pokes?
Yep.
Here we go. So these will sit for 15 minutes.
Those don't tickle. Trying to stay still as I can.
You're doing good. Do you have a follow-up schedule?
No, they were supposed to call me back on Friday. That's what I was gonna ask when I said earlier, but she never told me about a follow-up appointment.
And so I was going to ask about that. And then she had also told me to get an albuterol inhaler, but apparently you need a prescription for those. So I needed to ask about that too, but nobody ever called me back.
Was she giving you a sample, or?
I don't know. She just told me to get one for the next time my chest tightens up like it did last time.
Did she do an electronic script to your pharmacy?
I don't think so. They never asked me any pharmacy information.
Did you fill out anything like on a questionnaire?
I might have. I think I did, but I don't know. Like, I asked the pharmacist and they said you just need a prescription. So I don't know.
Literally the night before we came in for the checkup, she had a real bad allergic reaction.
Okay.
And we're not really sure what it was. But her chest tightened up quite a bit and she had a hard time breathing, so she was just worried and wanted her to get an inhaler.
Did I bleed a lot?
They don't bleed at all.
Okay.
Yeah, this is just the amateur that I'm wiping off.
You're written up pretty nice, but it could just be your graphism.
Yep, I was about to say, how about the not across
Control.
the skin.
Your control is pretty popped.
This one is really red. I'm sorry.
You're okay. Yeah, you have sensitive skin.
Mm-hmm.
So we're going to let these sit for a few. Do you want this tied?
I don't even care. I've been through enough doctors. I'm like,
Okay, so I'm going to demonstrate how I put on the patches. Like I said before, each strip has 10 allergens in it. For the average adult, we put on about 10 to 15 strips, and for children, it's about 5 to 10 strips. So usually we like to have a clear back. We don't put the strips over any tattoos, and if a guy comes in with a hairy back, we do have to shave the back, or he can do it beforehand. So I will demonstrate how I put them on. And that's it. And usually it covers the entire back, so be prepared to be all taped up to at least down to here. Okay, so now I'm gonna put on some tape so that it secures the patches on the back. If we left it alone, they would just fall off eventually. This is hypoallergenic tape, so it does not cause any irritation. A lot of patients are concerned with that, but we've never had anyone have a severe rash from this tape. That is about it, and then they will leave that on for 48 hours and come back in to take it off so we can draw on their back. Okay, so now I'm going to remove the patches. This is usually we put patches on Monday and they come off on Wednesday, so I'm going to take them off. They can hurt a little bit, but some patients enjoy it because it scratches the back. So we also tell patients to wear either dark shirt or something they don't care about, because this purple marker can rub off on their clothes and ruin them. We aren't sure that it always comes out. And I'll just number it so that we know where each patch is. on Friday, and so Dr. Yu can read the results. And that's it.